take the AED out, okay? What's the first thing we got to do, gang? Yeah, turn it on. If you don't turn it on, it's not going to prompt you, okay? So first thing we need to do is turn it on. Lid pops off, okay? On these Zols, there's a nice little diagram in there that shows you, you can put this under a patient's head if you want. That's up to you if you want to do that, okay? And reinforced all the way through the AD, besides the the audio prompts, it gives you a diagram on the AED, so you can kind of see the steps you need to take, okay? One thing I want to caution you on, if you have a person that's in cardiac arrest and someone's already doing CPR and they say, hey, go get me an AED, and you're the one that goes and gets it because you know where it is and you're comfortable using it, don't interrupt the CPR, okay? And I'll show you, as we're doing chest compressions, I can place the pads on, okay, while you're doing compressions. Okay, we don't ever want to stop our compressions, right? Okay, we want to keep our interruptions of chest compressions to less than 10 seconds, okay? So I'm going to turn it on.
Unit, okay. Stay calm. Check responsiveness.
That's good, right? Stay calm. Okay, so it's prompting me. Call for help. Okay. Now, the pads, let me show you. Zols are really nice because they have these preset pads. What is probably going to happen is when you open it up and take it out, these pads are going to be in a wrapper, okay? You'll have an adult set of pads, and there should be a set of pediatric pads, okay? Obviously a kid, right? You want to swap the pads out. Okay, the default pad that's going to be in there is going to be an adult because that vast majority of the time, your patients that are in cardiac arrest are going to be adults, not pediatrics, okay? If you have a pediatric and you open it up and there's no pediatric pads, can you use adult pads? If that's all you have, yes, the American Heart Association has now come out and said yes. If that's all you've got, and you have a child that's in cardiac arrest, you can use adult pads. However, they cannot touch each other or overlap, okay? So be aware of that. You can put one on the front and one in the back, okay? Don't let that throw you, okay? So you tear open the pads come out. Usually the adult pads are connected, pre-connected for you. So if you notice, Zol's kind of nice, and this is particular to Zol. They're pre-connected, right? And it kind of lays out nicely for you, okay? And it gives you that's your compression target. So let's talk about our patients for a minute. We're going to have to expose our patient, right? So let's have an adult conversation about that, okay? It has to be pad to skin contact, okay? So obviously, with that being said, you're going to have to expose your patient to get the pads on, okay? If it's a female patient, okay, and they have a bra on, you're going to have to get that out of the way, okay? So either pull it up out of the way or take your trusty scissors that you have in your bag and cut them. So, and then let gravity take effect, right? Everything good gets out of your way and you get your pads on. Okay. Only thing you need to worry about when you're putting these pads on is you don't, again, pad to skin contact, right? So you want good contact with your pads. If they have a pacemaker, okay, which will look like a little square, a little bit smaller than a pack of cigarettes, you may see that, a pacemaker or / internal defibrillator. Don't put your pads on that. Just move your pad off to the side, okay? Medication patches, have you guys seen those? Some people have medicine that's absorbed through the skin and it's on a clear patch, okay, with the medication on it. Don't put your pads over that, okay? If you have to take it off, you can take it off, but be careful. Don't peel it off and stick it on your bare thigh or on your arm or something, because guess what's happening? Yeah, you're getting a bullets of their medication, right? So just be careful. I would suggest if you peel it off, just stick it back on them. Don't let it wrap around your hands or get stuck to you, because then you're going to get a dose of their medicine. Okay, make sense? Jewelry, anything like that needs to get out of you need to move it out of the way. Okay, everybody good with that? Okay, so we're going to expose our patient. Okay, Now these pads are really, really sticky. Okay, these are trainer pads, so they've been used a bunch. Because they're very sticky, I would recommend when you peel, I'm holding them up because I want you guys to see it, but when you peel the backing off, try to do it close to them. If it folds over on itself or something, you got a mess going, trying to peel it back apart and everything, okay? The best way to put these on is like this. Roll them on, get them on, they're really good. You want really good pad to skin contact, okay? And the adhesive's really good, that gel, okay? And then also with these, if say you've got a really big person or something, these Velcro apart. Okay, so if you need to take them apart, you can take them apart, okay? Other manufacturers of AEDs may not have this kind of nifty setup for you, but don't let that throw you. If you don't have this set up and you're not sure what to do, look at the pad. It'll tell you on the pad, right? Right, so we're going to put our pads on, okay? A big question, and like I said, we've been using these for training, so they're not sticking really well. What if they're wet? Say you have a drowning patient or something and you pull them up out of the pool and they're wet. Is it okay to use this? Yes, absolutely, okay? Wipe them real quick. Don't try to dry them off completely because you'll never do that and we're wasting time, right? Grab a shirt, a towel, whatever you can get your hands on, do a quick wipe and then get the pads on, okay? What if you open your case up and the safety razor's not there and you expose the patient and he's really hairy? How can we get the pads to stick well? I'm going to teach you a trick. If it has pediatric pads in there and you have an adult patient, take the pediatric pads that you're not going to use, stick them really good on your patient, and rip them off, okay? If they're not in cardiac arrest, you'll know it then because they'll come off the ground, okay? But if you're sometimes you can look at somebody and they're real sweaty and wet and they're very hairy and you know those pads aren't going to stick real well, you can give them an instant, okay? But remember, you want to use the pads that you're not going to use because once you do that, those are done, right? Mm-hmm. So you can use those pediatric pads, get them on there really good, rip them off, and then we put the correct pads on. Make sense?
Makes sense.
Okay, cool. All right, so our pads are on. Where's my remote? Here, we'll start over again here. Let it cycle through. Okay, so we're on.
Unit okay.
Okay.
Stay calm. Check responsiveness.
We're all calm, right?
Call for help.
Okay, help.
Attach defib pads to patient's
Remember what I told you about dialing 911 on your cell phone, hitting speaker, and put it down right next to you. Okay? So pads are on.
Attach defib pads to patient's bare chest.
So it's prompting you. Get the pads on. So if we were working a code, I'm doing compressions while you're getting everything ready. I'm not stopping and going, oh, he's here with the AED, good, and stepping away, right? We don't want to do that. Keep doing CPR. Let them get the AED out, get the pads out, everything ready. You ready? Yep, I'm good. You should be able to get these on in less than 10 seconds, okay? Unless the guy's super hairy or something where you go like, ooh, uh-oh, we need to do something about that, okay?
Attach deep, don't touch patient.
Okay, then it's going to go into analyze mode, okay? That's your next command. When it goes into analyze mode, that's when you stop CPR. Everybody goes hands off, okay? Reason why is if you're touching the patient and moving them around, it could affect the way that it's reading the cardiac rhythm. Okay? So, all right, it's analyzed. It's determined that the patient's in a rhythm that you need to shock. Okay? Next thing you need to do is make sure no one's touching the patient. Everybody back up, clear, nobody's touching anybody. And then what I recommend you do is go, I'm shocking. Everybody ready? Shocking, shocking, shocking. Another reminder, make sure nobody's touching them. Then you're going to hit the button. Okay?
Don't touch patient. Analyzing.
Hey.
Shock advised.
Okay.
Don't touch patient. Press flashing shock button. Shock delivered.
There we go.
Start CPR.
Okay, so you're going to deliver the shock. It's going to jump right back in and telling you to do CPR again. Okay, you jump right back in your chest compressions. Guess what that's doing for you? It's counting your compressions. Okay, so you can just follow along with that. Okay. So you may get commands while it's doing that.
Push harder.
I'll actually tell you that. You're not pushing hard enough, okay? Or you may get good CPR,
Good compressions.
okay? It'll tell you. Push harder. If you're not pushing hard enough, you need to start pushing harder, okay? So we'll let it go through the cycle so you can get the whole cycle. So what it's going to do is it's going to go through 4 cycles of compressions and ventilations. See the pause right there? That's when you would do your ventilations. Okay? Then it goes right back into chest compressions. So you're going to get 30 and then a pause for 2 breaths, then 30 and a pause for 2 breaths, then 30 and a pause for 2 breaths, then 30 and a pause for 2 breaths. Okay? Then it's going to go back to analyze.